Cervical cancer is a cancer that starts in the opening of the uterus, the part of your uterus that gets dilated when you're having a baby. And it is honestly formed by a sexually transmitted disease. The virus that causes cervical cancer is called the human papillomavirus. This virus is extremely common. Almost 80 or 85% of women in the United States have been exposed. They may not know it, but they've probably been exposed at some point in their life. And the virus can be latent, meaning that you can't see it when it first happens. So just because you get diagnosed with the virus doesn't mean that you just got it. All women are at risk, but the more sexual partners you have, the more likely you are to be to get the virus. People who don't get pap smears are at greatest risk because that virus can lead to a precancerous lesion that eventually grows into the cancer. So that's why women who get diagnosed with cervical cancer very often haven't had pap smear for a number of years, sometimes since their last child. So here's the thing about cervix cancer. There are usually no symptoms in that pre-invasive stage, and that's why the pap smear is so important. Now, it's really important that you get, if you haven't gotten a pap smear and you're over the age of 25, that you need to go get one. So if you get a pap smear, they might find pre-invasive disease. It has no symptoms whatsoever. If you have a lesion that's grown and really gotten to the point that it could cause pressure and pain, that would be your first symptom. Other people have symptoms like postcoital bleeding, so bleeding after intercourse, or just irregular spotting. All of those symptoms should be looked at. Again, I guess one other that could be a possibility is a bad smelling discharge. That could be any number of reasons, so it just needs to be looked at.